Right.
Well, I
right.
think that we should suggest a name or a couple of names.
Yep, we should suggest a couple of names. A couple, just like come up with a couple. We can have, if we can have most of this done again by the 31st, just for our first draft of everything and anything, then we can like fill in the pieces after the 31st.
Okay. And I mean, Sophie and I are going to work like as a little team of one. It's even though there's two people, there's going to be one, it's really one person working, you know what I mean? So whatever assignments I get, I'm going to work closely with Sophie, just as like a training mentorship kind of thing for her for grant writing.
All right. Well, let's go right quickly to the target population. Like for this, as a brief description of the target population groups or groups being served. So not only do we have the counties, we also have the providers that are in there as well. So, you know, that's like some of the breakouts that we need to look at in the teams that we're going to create. So, God, I'm just jumping in. I'm not letting anybody talk.
That's all right. You know what? Let's just do it. Forget it. Who cares? I'm not, you're not hurting my feelings.
Go for it.
When it asks for brief description of the target population, does it, we're talking about the Hispanic, the underserved, what are we talking about?
Hispanic and Native.
All of it. I mean,
Okay.
Who's in the county? How are they underserved? See, that's just some of the data stuff that I'm going through right now.
Okay.
The health professional shortage area, I'm checking that out. Then trying to like overlap behavioral and dental, because we know that we want to have, you know, dental up in there. Yes, low income, rural. And then if we could like find out right now some internal data from the agencies who they actually serve, just get some really high level stuff, you know, so that we can start to compare that about what the CHWs and CPSWs would bring to the table.
But I think that we should say, you know, the population is general, but with a high predominance of Native and Hispanic community members.
Absolutely. And the census data is out now, so we can go to the census level track for, is it Otero and Sandoval County? Is that right?
It's Sandoval and San Miguel.
San Miguel County, San Miguel, okay. San Miguel. San Miguel and Sandoval.
Now, aren't we supposed to have 3 different locations?
It's up to us. It's up to us.
I thought that was mandatory.
No, it was we need it with 3 partners.
3 partners.
Oh, 3 partners. Oh, I'm sorry. Okay.
Yeah.
Okay.
John says, what data do we want to ask of our partners? We definitely want to ask about demographic service, like percentages. It's like for our demographic data, what breakdown do they collect? Because one of the things that we might have to do is like create tables that show shared data points.
Oh, okay.
Okay.
So a question like, what data points are you willing to share about your clients in these counties? You know, something like that. Create. About your clients.
Okay.
I put in the draft on the notes here in the chat. There were just some areas that were discussed in the meeting. In addition to those 2 was Guadalupe and Doña Ana. Just
that's right. That's right.
Guadalupe.
That's right.
And Doña Ana. Okay, so those are the counties. So what I'll do, this is like for our group, I'll just pull up whatever files I can from census tracts and just kind of like put them so we can eyeball what the data stuff looks like. And like they've got really basic demographics, and I'll see in the census data, and I'll see if they have those throughout each of the locations.
Oh, okay. That won't let me move it. Okay. All right. So how about if Sophie and I will target that. We'll take on this part right here, the target population, and writing that paragraph. We'll take that on. The network consortium partners. Okay, also on this, Sophie and I will also take on looking up the census data for that area and contacting our partners for the demographic percentages. And then you'll have to tell me what kind of tables you're really talking about. I guess that part I didn't understand, but we can work on that once we get the data, okay? So now what about network consortium? What was one of the takeaway action items was we need to provide the data that we need for, so like the stuff that I sent to Molly, the 3 parts out of this actual application, that we need that information from those partners. There were 3 different sections that need that. So Molly, maybe you can get the first bullet of provide the organization names, facilities from that information I sent you.
Okay.
And then we need to find out, we'll find out what the letter of commitment, how that looks when we go in here. And am I moving along all right?
Yep.
Okay. So this would be one of the questions for them also, Molly, for them to describe their experience serving their capacity. And that's where Jay also mentioned up here, get from the agencies who they actually serve in these areas. So yeah, they need to describe their experience.
You're talking about the healthcare providing agencies.
That's correct, though, our partners,
Okay.
yes.
Okay.
And then HRSA requires that urban applicants describe the geographic relationship to the proposed rural service population. I'm thinking that we could probably take that on since we're going to be working on this part up here. Sophie and I will take this, if you're okay with that. Is everybody okay with that?
Part again.
This part about the urban, describe the geographic relationship to the proposed rural service population as well.
Oh yeah, that's all CDPC. That's all convener stuff right there.
Okay. That's interesting. Look at how that took that font on. That's weird.
You know, Trish, it's like usually the abstract is written last.
Okay.
But I mean, it's like writing it first. Don't feel bad if it gets changed later on.
Right.
Because but you know, this is great because like I said, it's really helping us to answer some of the major sticking points along the way.
Okay. So here's the narrative guidance.
Right. Like, for instance, we need to conduct a needs assessment of our partners so that they can tell us specific information about their challenges. We can ask, for instance, like about provider load, how many clients you're having, how many clients you have on wait list, things like that. I'm actually coming up with questions. I don't have anything today, but that's the kind of stuff that we need to demonstrate in our need. Not only do we use census tract, but we also use information directly from the field. So again, that's why our MOUs are so important in figuring out from them what is happening is on the way. So like for those need questions, can we give me until next week to come up with something for review? And then I can have it ready to send out by the 31st. But
Okay.
I need some time to review, to bring it together.
So you're going to take on the just the needs assessment and the methodology, the work. What do you think? Or tell me, because I'm typing way too much here.
What you're typing is looking good so far.
Oh, okay.
The methodology is like I'll have to work with Molly around that, because it's going to be linked up with what data we collect. And that's like Square and the evaluation and measurements pieces. So that's the kind of stuff that she and I are going to have to kind of work together around.
Mm-hmm.
And again, I think the work plan is which is going to include the impact, isn't going to be ready until after we collect our data from our providers. Like right now, John, you shared our list of providers. They're like about 4 or 5 key providers so far, right? It's pretty tight.
Right.
Yeah, that's all we need to start working. Because so that's who we pull. We don't have to pull like 60 or 70 agencies. We can just start with who we have.
Which is UNM, PMS, and Sandoval Regional Medical Center.
That's beautiful. That's
Well,
beautiful.
and Umoja too. We have to
Umoja too,
you
right?
have to include you as
Right.
that fourth partner.
Plus, we have
The
Carla.
dental, the oral.
And we have the viewpoint of OPRI, the viewpoint of the CHWs. So we have a whole lot of constellations that I really need. I really want to be able to like sit down and say, hey, do we have information from this line, and from that line?
Right. Okay.
So that's all associated with the needs assessment, and that's going to work into the work plan.
Okay.
So Trish, what I'm gonna do, I have UNM, Sandoval Medical Center, Umoja, well, and then what is it, Presbyterian.
Yes.
So I'm gonna go.
Actually,
Huh?
I have Sarah House reached out to me from PMS, Presbyterian
Mhm.
Medical Services. She wants to have a chat with me. So I need to talk with her first to see what's going on.
Okay.
Because I think she wants to know how much commitment she has to put into it. So she just reached out. To me.
Get your elbows ready, Trish.
I am. That's one of my skill sets, I would say. I'm good on my knees.
All right.
Well, the reason I raised that is because I'm gonna need to know the right people to talk to, and I'll put together, a general list of the things that we have to have that that we'll be able to send to all of them, because I'm sure at this time they're going to have their reservations answering so rapidly. So I'll work with you, Trish, on that.
Okay.
And some of it might just be general information, in terms of numbers and population that might be readily available, but we'll go through it.
All right, Jay, I'm going back to you. What number are we on? Are we?
And I mean, actually, by the 31st, that's what we can really do by the 31st. If we can, if we can meet again early in the new year, or figure out what we can do again early next week to, get ready for the next push, because a lot of our writing is going to be based on what we are getting ready, what we're doing right here.
Okay.
Well, what I'm thinking is that, we go through and create a checklist of the information that we have to have.
Oh, you froze on us. I put that in the chat just before you mentioned it, which is great.
And
We're
what is,
thinking the same.
because I have those checklists that I created, if you'll recall. Where is my, there it is. So we've got the checklists that Jesus Christ, because there's going to be a lot of information we need about our board of directors, our
Yes,
executive director, all that kinds of information.
yes. Mhm.
And I can share there's 3 different checklists because I'm trying to compile, put them together, make one. All right, so I'm moving on, right?
Right. Yeah, because we can't even get to the budget until we know what we're spending money on, you know? So getting these other things together first is great. Hey, Laurel.
Hi guys, how are
Hi.
you? Trish, I'm glad you were able to get on the meeting. Sorry, I just saw that text. It
Oh,
was
that's okay. No worries.
a meeting for that other grant. So, but thank you. I appreciate it. And I'll listen to this recording to be sure to catch up.
And so this is the part that comes in that ties into what we just talked about up here. When you said, Jay, the actual questions that they ask you or what they want is explained here in this area.
Mhm.
So here's the
Yes.
needs assessment, the
Yes,
community needs. So this is what we'll
Yes.
be referring to when we're writing our stuff.
right. So go back up a little bit, where it says community need. Here, we have mixed communities.
Sorry, I just got bumped off. I don't understand this at all.
Yeah, we said, wait a minute, where'd she go?
You know, all of a sudden the whole phone shut down and I'm fully charged, so I don't know.
We were talking about the communities that are being served, and a sort of mixed community. So I wanted to make sure that we wanted to see if I'm off base primarily, you know, because there's the provider communities, and then there are the consumer communities. And the providers are the certified licensed agencies and their and their staff, their therapists, their counselors. Then the other providers are CHWs and CPSWs. Those are in the provider camp.
Right, sorry that I'm just trying to put them as footnotes on the actual thingy
Mhm.
itself.
Yeah, I'm trying to like move with you on that. Then there's the consumer camp. And then then we have the needs of the consumer camp, which are service needs, but also waitlisted needs. You know, how many of you want to get in, but you can't get in? So that's access to services. If we're doing access to services, we have to be able to demonstrate what does access look like.
Ah, okay.
What about the business community? Their involvement or their difficulties that they've had, maybe even getting people treated or.
Great question. Oh my God. Absolutely. Absolutely. So, you know, I mean, what we're talking about is an intact community. It's like a lot of people think that behavioral health happens one individual or one family at a time, but we're taking a larger look at the impact of this. We're looking at systemically, how does behavioral health impact the systems, the individuals, the families, all of that. That's what I think. And I would love to be narrowed down. I would love for us to be narrowed down to say to the dot, this is what we are looking for. John, what has to happen for you? What needs to occur for you to come back?
Nothing. I can just, I'll just call back in on my phone and just be able to be in. So thanks for asking, Jay.
And I'm sorry that I took this out. It's just that I had highlight all these areas, John, and that I thought that we needed to cover today. So I was, yeah, I'm sorry.
That's all good. And I think that's why that checklist and having one checklist together, which we can just check things off as we go, would be really helpful.
Okay. So you're going to be checking out now? Are you leaving
Yeah,
us?
I'm gonna log off, but I'm gonna log off video, but I'll be on phone for the next
Okay.
30 minutes. Yeah, but I'm gonna put
Right.
in, yeah. So I'll be continue.
So we're just-
So I'm going to start working on the introduction and the needs assessment for criterion 1. So I'll
Yes.
start working on that right away. And if we're able to meet next week, I can just show everybody what we have.
Okay.
Okay.
And then we can update. Now, question, are we going to create a Google file so we can just send stuff there, or a Dropbox, and then you can review it whenever you have time? Or how do we handle shared documents?
Yeah, if I could ask Sophie to do that, that would be very helpful for us, Sophie.
Yeah, totally. I think we actually, I'm gonna check right now. I think we actually might have a HRSA grant Google Drive already.
I thought we had started something with the with that going on, right?
You might have already done that for us, yeah.
We just have to start using it now.
So you guys are gonna finish looking at the letter of support, and I'm gonna look at the requirements for the MOU and make a format on the information that must be delineated on that, and put that together. And then I'll talk to you, Trish, and get the right people that I need to talk to, and at the right time that I'll be able to collect that information from them.
Right.
Okay.
And Molly, one of the things when you asked about businesses,
Yeah.
that opened up a folder in my head about impact.
Mhm.
What will be the impact of more services? And I'm just like kind of throwing that out there. I don't have anything to do with it. I just wanted to speak it out.
Well, with the business community, them having to deal with employees that have issues, maybe putting together a questionnaire. I can put together a simple questionnaire, Jay, and send it to you.
Okay.
And then maybe we can banter about that, because I'm thinking that they would have had situations where they've had employees that required some type of intervention, and they didn't know what to do or weren't able to help them. Maybe people were uninsured, or so on and so forth. So, their experiences, even to find out if they've had an experience where they would have really liked to have some guidance. So I'll put together a simple questionnaire that we could try to extract information from the business community.
Okay, that'd be great. That'd be really great, because we could probably get something out from some of the key businesses in those 2 counties. We would only need about 20 responses overall.
Okay, so let me just put together a little something, maybe 5 to 10 questions, because
Yeah.
not to overload them, and then to find out, what they are doing. First off, even if they offer those type of services, in their, so I'll put together something and send it to you, and then we can put,
Oh, she froze again.
Yeah, we can discuss. Yeah, no, I love that. I love that idea, because we can really talk about what access means. Molly's talking from a business perspective, that's EAP and other stuff. And I do have a question, and this is pretty much to the thank you, Sophie. This is pretty much to the CDPC team. Is there a possibility of like you guys wanting to run or maintain a CPSW or CHW profile website, so that if I am I'm someone who wants to like talk to somebody, I want to talk to a peer in PCOS, it's like I can like go to a checklist, and then that checklist was like, I was like, I need someone to talk to me about drinking, depression, feeling isolated. That checklist would take me to an agency, you know, and then the agency would say, oh, we can provide a peer who has these services or skills, or CHW, and that can get you in touch with.
I can definitely believe that or not. Believe it or not, I can do that. On our website, I can definitely create that kind of a form on there. And yeah, I would just need to know exactly what you want for that. Yeah, I can do that. Is that what you're talking about, or no? Did I miss?
Yes, I am actually. It's really a referral, because this one, CDPC has to be able to stay in the game after you get the money.
Right.
So for that to happen, there has to be a reason to keep you there. If you guys already have linkages for profiles, if you're already maintaining, this is part of a convening activity. If you're already convening and have information that can link the community to services, that is another form of income and another strand of where you can move as an agency from there. Because you're impartial.
Right.
Now, for one, you don't have to be responsible for knowing if an agency or a peer has kept up their certifications. What you're doing is like creating a record of services that are available in the community, and which agencies can provide access when people need help. Like when people need help about homelessness or housing, and they need help about food insecurity, they'll go to a number of places. It's really just a matter of maintaining a checklist so that people keep coming back to your website.
Okay. Well, that's a lot for right now.
Jesus, is it not? But let me know. It's like when we talk more, let me know what you need. It's like it's in my head that I need to pull out, and I will.
Okay.
And then when we meet more, we can just flush it out more.
Okay.
Yeah. How does everybody feel so far about doing this? Thumbs up or thumbs down?
I'm good. I still think it's doable. The doable. I'm still good with it.
Great. Great. I'm a big thumbs up. This has been consuming my imagination and creative time. And it's like, you know, so it's like some of the, knowing that you're willing to do the referral piece is really big. It's really huge. And then, yeah, everything else. Then working on the needs assessment. I really like Molly's idea about talking to businesses, because this is getting a way to say how we are an integrated community. And the businesses are concerned about behavioral health, mental health, and they say these things. That's a really sweet touch to add. And when we refer back to the senators, that they'll be interested to use some of those same talking points, depending upon how we can frame what the data gets back. And we, like I said, we only need about 10 from each location. So that might be an ask that we have of our partners. Would they be able to share I'll create a survey link to give the survey, the SurveyMonkey link to like 20 or so business partners in the respective counties.
Well, that's just it. There's not going to be 10 businesses in those counties. We're talking like the Cuba public school systems are one, the PECO school systems are another. the clinic area or clinic. So you might have like a Dollar General or a Family Dollar in those places.
Absolutely.
And,
They
yep.
count.
Yeah.
That counts. That counts because, yeah, because those are places that CHWs go to.
Right.
Yeah. CPSWs live. So yeah, it's like getting a community viewpoint.
Because right
And
now,
most-
I can tell you in both Pecos and Cuba, you're not going to have 10 businesses.
All right. I mean, I believe you, Trish. I'm just saying that we can do the activity and just see what the data brings us.
And can you remind me, Jay, does that map say if it's rural or frontier? Because I think Pecos and Cuba are frontier.
They'll just call it rural, which
They'll
is
still call it
inclusive,
rural?
which is inclusive of frontier. Yes.
Okay, okay.
We'll call it frontier.
Right, because it's frontier, I'm telling you right now, it's
Yeah.
frontier.
No, I believe you. I believe you for sure. Oh, wow, this is good. Okay. Let me see. I have 30% battery left. That's plenty.
What's interesting is these businesses may have had problems with the community.
Yes.
So they would be happy to highlight, oh, they sleep in front of my business overnight, blah, 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 things like that.
Mm-hmm. Right. And
Okay.
restaurants. I mean, just imagine the impact of behavioral health on restaurants in any location that we can go to.
Right. You might get one restaurant in each area.
All right.
Anyway,
Great.
yeah.
Well, we'll put together, and we may not have but 5 questions instead of
Yeah.
10, but we'll have a good 5.
Yeah, that's it. That's it.
That I can do because I know both Cuba very well and I know Pecos very well. So yeah, I can do that.
Well, I'll put together something, Jay, and then you can add on. I'll send it to you, and then you add on your comments, and then Trish can have the last review because she knows them better than
She knows them better than we do. Yeah. Okay. That'll work.
And then we just disseminate it,
Mhm.
get the email, because some of these businesses will have to get corporate approval to answer.
Right.
That's true, like the Family Dollars and those guys. Yeah.
Exactly.
Uh-huh.
Okay, so I'll work on that first before I go with the other thing, because that may take a little bit more time.
All right. So John suggested we have our next conversation December 30th, then again on Friday, January 7th.
Okay.
Okay, both of those I'm good for because we want to turn it in the 17th or something like that, right?
Right.
Yeah.
Okay. So I'll also, when we meet on the 30th, I'll also come up with the plan for the work groups and see what they're able to say for the needs assessment.
Okay.
Is 10 a.m. good for everybody on the 30th?
Let me look at my calendar. Yes.
I have a doctor's appointment, but I may move that anyways.
Oh, look who's here. Hello.
Hi, everyone. I have a follow-up ultrasound, but I'm healthy. So
Yay.
I found a lump last year, but it's just benign, but I have to go every year to get it checked. So stay
Good
healthy.
news.
I know it's
Good
great
news.
It's great news. So
I
I was worried last year, but yeah.
I hate Fridays. You guys, I can't do Fridays. January
30th, isn't that a Thursday?
January 7th is a Friday.
Oh,
So what time? Okay, so did 10 o'clock work okay for everybody on the 30th?
Yes.
I can do 11 if I'm gonna call and confirm that ultrasound, but I have that then.
Okay.
I can do either one,
Okay, let's go for
10 or
11.
11. All right, I can do 11.
I'll be there. Okay.
And John, let me see if John's chatting yet to
He
tell us.
said anytime on the 30th
said
works for
anytime.
him.
Okay, great. So then on January 7th, Friday, what time works for everybody on that time?
I'm free all the way up until 3:30.
Let's do 11 again.
Okay.
Great.
I'll send those notices out real quick.
Okay.
Yeah.
And And I'll include in that the action items and things like that that we need to get that done by then, okay? So I won't do it real quick, but in the next half hour, so.
Okay.
That's
All
way
right.
too slow, Trish.
I know.
Come on,
Oh
Trish.
my God.
Gotta get on the ball, Molly, Jesus.
I
Okay,
mean, my goodness, you making everybody look bad here, girl.
I know,
Yeah.
Trish.
I know.
whatever. Thank you though, appreciate that.
Thank
All
you,
right.
everyone. Okay.
So, are we done?
Yeah.
Keep
Okay,
going.
Sophie, stay on the line because we got business to talk. So,
All
Sophie,
right.
we
All
got
Have a
right.
good one. Take care.
All righty.
you.
Bye-bye.
Chris.
If I don't talk to you all, Merry Christmas.
Oh,
Merry
yeah.
Christmas to you
Christmas.
too.
I'll see you during
Take care,
Kwanzaa.
everybody.
Okay. Bye-bye.
Trish, let me know if I
Bye-bye.
can support in any way. I'm
Okay,
here.
you can stay on with us if you want, Laurel. If
Sure.
with us.
Laura, are we still meeting tomorrow?
For staff, yeah, we'll just do a quick check-in before we
Okay.
disappear
All
for the
right.
holidays. Then
Okay.
we're off and about.
All righty. Just double checking.
So,
Okay.
bye. I wanted
Bye-bye.
you to look at your calendar for this week,
Okay.
because I'd like to meet if we could again in person,
Mhm.
Sophie, and go over some of the stuff that I wanted. You're looking for hours for over the break, right?
Yeah,
So yeah, if you want to get together, I'm thinking probably tomorrow might be the better day, the 22nd.
And Sophie, I can give you quite a few things as well.
Yeah, well, yeah, we both now that we can give you stuff.
I have
So
lots going on all of a sudden. So
if,
you can start with Trish and then see how you feel, and I can give you some more.
okay.
Cool.
And then for this grant thingy, we will need to work just for mentoring and just to get you going on grants, because I think you have great writing skills. I think you're gonna,
Mhm.
you know, you could tackle this easily. Plus you follow instructions.
I'll try.
That's great.
It helps if you follow the instructions.
Yeah, really. How's your sister, by the way?
She's okay. She's okay. Her car is totaled. She's actually at the ER right now, but they just wanted her to get her chest x-rayed because she's having a lot of chest pain from her seatbelt. But honestly,
Aw.
it was a high-speed crash and it could have been so much worse. So I'm just happy that she was able to walk away from the accident.
Right,
I'm really glad to hear.
right. So do you want to meet at the office at 11 after the quick check-in at the staff meeting? We could just run to the office and meet there at 11 and then work through lunch or something.
Yeah.
Let's do that.
Okay, and then check in with me afterwards and I can definitely give you stuff because of these 2 additional funding proposals and lots going on. So we got you, Sophie.
Yes, definitely, for sure, for sure.
So was that that grant you were talking about, Trish, the other day? That's not related to this one, right? It's completely separate.
Completely separate. It's Laurel's got that one. Laurel's knows what's going on with those two.
There's 2 additional ones. One is through the cancer funding. It would be great work for you, Sophie. I already submitted it this morning because they had to have it by today, if you can believe that. You were making me crazy. So that's finished. And the other one, I have a meeting for later today, and that would be another application. This one they submit because it's through the Department of Health. The other one I have to get to work on, but I need to understand it more. So I already got the cancer one through. I forwarded that to you, Trish.
Okay,
So,
great.
Yeah, and that's.
And if I can help you at all with that other one too, you know, or
I need help.
or
There
sit in on the meeting or whatever, I could do that.
today at 1:30. I can't get on until 2.
Oh, and you know what?
Yeah.
I'm meeting the Geek Squad at 1:30 to go. My computer is really,
Why don't I hop on with them and arrange another meeting? Because it's not a good time for me either.
yeah,
Maybe tomorrow or Thursday,
yeah,
and then get that ball rolling. So I'm going to suggest that
okay.
for them. Does that work better, Trish?
Yeah,
I'm gonna
that would.
get on, and I sent the letter of intent, and I heard back. So at least that's rolling, and there's a month to do that one. But I'm going to get on today and say this isn't a good time, and maybe shoot me a couple of times or a few tomorrow or Thursday, and
Okay,
let's clean it up with them because it's another quick one. But I got the cancer one in and done.
great. Jesus, that's crazy. All right. All right. So yeah, so I just want to make sure that I hand over the stuff to you, Sophie, and then show you how to get to the stuff. You know what I mean? And then,
The data.
yeah, okay. So that's it. So 11 o'clock, if you can tomorrow, that'd be great at the office. Let's do it.
Yeah.
All right.
When we look up census data, do we use like a specific website for that?
You know what? I haven't looked up census data since 2012, so I don't remember. I'll have to look at what my last report for the hospital association and see where I got that information from. But I'll get that for you. That's a great question. Thank you. I think there's a special place I think that we have to go for it. I'm pretty sure, but I can't remember.
Okay, and yeah, Trish sent me a couple times. I'm writing them right now.
Okay. Oh, well,
Okay.
you know what? What days, Laura? You know what? I'm free if it's this week, except for the Geek Squad. Except for the
Tomorrow or Thursday. Thursday I have a voice coaching in Santa Fe, but I can do any time in the afternoon.
me too. I'm
Tomorrow
fine.
I could do, I have an accounting meeting, but anytime in the afternoon. So I'm just gonna suggest to them, like, I'll write them and just say, let's do,
Yeah, Thursday afternoon's good with me too.
okay. I'm gonna just say that real quick.
Okay. All right then.
I'm just gonna say, I can bring in our staff. Okay,
Because I think I'm also just Laurel too, that so that you know, I'm going to show Sophie tomorrow how to do a CEU application
okay,
so that she can, because I'm doing that nephrology conference because we're kind of doing it as a partner for them, blah, blah, blah. So yeah, she can learn how to do that as well. That would be very helpful for
that's involved
quarterly
with that
meetings.
cancer. Some of it, they want CME, so, but
Well, that's
we'll,
okay because we've got Leland. Remember Leland Metzler from Presbyterian? Again, Leland goes by they, them. So they said they can help me anytime.
okay, great,
See me. So we have a contact for that at least. Yeah.
fantastic.
And
Okay,
I will call Leland for that.
I'm gonna write down Thursday, let's just reserve Thursday and we'll get that all rolling. There's lots going on.
All right. And so Sophie, I think that we'll end up either ordering lunch to bring in and then just like kind of working for the whole afternoon because I really want to get some stuff to you that if I could, it could relieve me from doing like CEUs, you know? And for the NM Action Conference, that could be really helpful for us too, because we apply for them there as well. So
Anything that like takes pressure off you, because I know that you are under a lot of pressure right now.
it's just the HRSA grant, that's all. You know, it's just a temporary thing, I think, but yeah. Well, you never know. If we really get into grants, shoot, we could really be jamming pretty soon. The whole team. I mean, yeah, that would be super. All right, well, that's it then. Thank you. I'll see you at 11 tomorrow. And I'll see you all at staff meeting at 9, right?
At 10, this
Yeah.
one, because there's no communications and marketing. And then I'll let you know about the Thursday afternoon and I'll get that going. It sounds like they're gonna write, we're gonna be kind of the fiscal agent. So.
Nice. I can do fiscal agent. That's good. All right.
But I need to get them organized because it's all over the place a little bit. So sounds good.
That sounds like DOH. All
Right.
right.
Well, I know. I'm like, what? You guys, help me out here. This is so much. Like
I
in a
know.
day, I need a response. Like people.
I know it's almost we need what's that pill called, that alprazolam, just so that we could relax the stress at this point. Jesus. Anyway, all right, guys. Thank you very much.
Okay, thank you.
Bye.
Okay, talk to you later. Bye.